Probably trace your feelings about healthcare to the last time you went to the doctor.
Was it a good visit? And did you feel seen and heard? Well, not everyone can say yes. And that can be true for people in the LGBTQ plus community.
Brady Mallory is here now with more on this. Brady?
Right. Dr. Elizabeth Petty with the UW School of Medicine and Public Health says misconceptions and incorrect assumptions about people's sexual activity or gender identity can lead providers to not provide the correct treatment. The lack of support or affirmation from the healthcare industry can also lead to depression, substance abuse, and even death. That's why this new fellowship program at the University of Wisconsin-Madison could be a game changer and lead to systemic change in healthcare. The goal of seeing a doctor is to leave feeling better, but depending on who you are, that visit may end up causing even more pain.
The LGBTQ plus community faces an awful lot of healthcare disparities, both in access to care, but also in health outcomes.
It's an issue that's close to Dr. Joshua Cohen's heart.
I've witnessed firsthand how members of the community, even just friends and neighbors of mine, have been impacted by the lack of good care, the lack of compassionate and affirming care.
A recent poll by NPR, the Robert Wood Johnson Foundation, and the Harvard T.H. Chan School of Public Health found that nearly 1 in 5 LGBTQ plus adults have avoided seeking care out of fear of discrimination.
When you have a system that has disadvantaged people, you need to do more to help bring them back to the same level as everyone else.
The National LGBTQ plus Fellowship Program at UW-Madison's School of Public Health and Medicine could help bridge those gaps in healthcare.
This is an incredible opportunity for us to really become change agents in terms of the landscape and enhancing health equity for the LGBTQ population and non-binary, gender diverse populations.
The fellowship comes with a $750,000 grant from the AMA Foundation. The goal is to educate physicians on how to care for LGBTQ plus patients.
And we want to train physicians to be able to meet patients where they are and that people can present themselves fully and authentically to their healthcare providers.
More than that, Cohen says this partnership could be just one step in changing the whole healthcare system.
People's experience with healthcare in general impacts how they approach healthcare in the future. And so when you've had a negative experience, it not only impacts your perception of that specific physician with whom you had that experience, it impacts your entire perception of how you're going to be treated when you go to see a physician.
Petty says this fellowship will hopefully help new doctors dismantle stigmas, stereotypes, and discrimination LGBTQ plus patients may face, which may not always be intentional.
I think sometimes it does come from a place of people just not knowing and not understanding, and that's why the education component of this is so important.
And when it comes to future doctors' visits, both Petty and Cohen hope this program will be crucial to helping patients heal.
This has been a vision for so long. It's been something that we've been trying to achieve. So now to see it fully actualized is really personally impactful. And
more than 50 medical schools competed to be the first to have this program. Dr. Cohen says one of the reasons why the AMA chose UW-Madison as the inaugural school is because it's already shown a number of different organizations that incorporate diversity and improve health infrastructure. It's expected to start next summer.
Congratulations to them.
Yeah, I think we've all learned how important healthcare is this year.
Yes,
Absolutely.
that's true.